Rollout, the government, through the Ministry of Health, has vowed to support local manufacturing and production of health products to ensure Kenyans have access to vital services.
The COVID-19 pandemic unearthed some of the challenges deeply rooted in the global health systems, especially in the African continent. The shortage of the COVID-19 vaccines served as a wake-up call to many nations in Africa to fast-track the development of human vaccine facilities. In 2019, Kenya established the Gov't Institute with the sole aim of manufacturing the COVID-19 vaccines.
By setting up the infrastructure for manufacturing at Kenya Gov't, we are preparing this country for any emergencies like endemics, pandemics, which we were not able to respond to in 2020 when COVID struck.
The Gov't Institute now seeks to manufacture more vaccines like the childhood vaccines by 2025.
Kenya is set to exit from support from Gov't and UNICEF for our routine childhood vaccines by the year 2027, going to 2030. So that will be our initial focus.
The government has invested between 1.5 to 2 billion Kenya shillings in the Gov't project. On the 30th of January this year, Health Cabinet Secretary Susan Nakhumicha met the International Vaccine Institute Director General Jerome Kim to achieve the Gov't mandate through partnership in research, product development, technical assistance and local workforce.
Kenya Gov't is a partner in the mRNA technology transfer program for Africa, and we are already working closely with Afrigen. So we will be able to get that technology transferred to Kenya through Kenya Gov't, and therefore we are preparing ourselves for future.
The government has vowed to support local production for health products and technologies ahead of the UHC rollout on the 20th of October 2023.
We have identified the 4 pillars of universal health coverage. One of them, the commodity security that we are here today. Your Excellency, the other one is human resources, which we started the conversation 2 days ago as part of our celebrations. The third one, Your Excellency, is technology. All this cannot happen without leveraging on technology. And finally, on financing of healthcare.
Vaccines are not the only locally manufactured products. At the just concluded 2-day local manufacturing expo in Nairobi, a number of local manufacturers were able to showcase their products, including medical equipment, medicines, and hygiene products.
So this is specifically used for women after they give birth because of the bleeding that occurs after they've given birth. It's meant to contain that bleeding. So it doesn't have wings so that it does not irritate the stitches, because they are for those who have vaginal stitches that after they give birth, it does not irritate the stitches.
On Friday, President William Ruto presided over the official opening of the expo, where he promised local manufacturers of the government support through entities like KEMSA, KEMRI, and the Ministry of Health.
Local manufacturers in Kenya are now hopeful of getting a ready market right here in the country after President William Ruto said that come 2026, 50% of medical products will be produced locally. Elizabeth Atieno, TV47 from the KICC, Nairobi.